Hey, Democrats, it's not just blue states. The Medicaid fraud crackdown just hit Florida, the fifth state this year to be under scrutiny by the Trump administration.
CMS Administrator Dr. Oz is calling the Sunshine State a hotspot for healthcare fraud, posting on X, quote, "What I saw on the ground in Florida around durable medical equipment fraud was horrifying. The scale is out of control and not just limited to these schemes."
Centers for Medicare and Medicaid Services Administrator Dr. Mehmet Oz joins us now. Dr. Oz, thanks for joining us tonight. We want to stay on this issue because it's taxpayer dollars and it's money that's getting siphoned from people who need it. You're going down to Florida now. Now, I'm going to say I usually think about Florida as a pretty well-run state. So when you're telling me that you've got gargantuan fraud there, I'm nervous, but I'm listening. Tell me more.
Well, the state of Florida is very well run by Governor DeSantis. Despite that, you have elements in South Florida who have built up a massive and corrupt scheme around durable medical equipment. These are the folks that's the suppliers of these products sell wheelchairs and canes and knee braces. We believe that because there's just a heavy influence by the Cuban population down there might even be foreign involvement in this. But nevertheless, there are twice as many of these durable medical equipment suppliers in South Florida than McDonald's. That's a shocking number of centers, way out of proportion to other areas. And because it's been tolerated and often not brought to the attention for folks, because people keep it sort of on the down low, there's not been enough efforts to stomp it out. We're going after that durable medical equipment supplier fraud. We have a moratorium that is national now. We don't want them running from South Florida to Georgia or Texas. Across the country, we're going to slow down new suppliers being allowed to get licenses until we can get our arms around the magnitude of this fraud. But that's just the tip of the iceberg. Let's look at autism care, which is another good example, where we have a quadrupling of autism services in many parts of the country. In places like Minnesota, the actual money spent on autism went up over 100-fold. There are not that many more kids with autism that could possibly explain this. The other opportunity for fraud happens to be around personal care services, things like home health aides and a lot. The number one job in New York State, number one job where you are right now is not retail, it's personal care services. Think about that. We've taken this program that was designed with good intentions to provide extra support for older people in case of personal care services, for young people in the case of autism care services, for people who are dying in the case of hospice in California, which has a third of all the hospices just in LA County as the whole country. That is impossible mathematically. All of these well-meaning programs have been perverted, they've been corrupted, and they've been taking advantage of the American taxpayer. It makes it much more expensive to get health care in America, especially for our most vulnerable.
Yeah. We so appreciate you shining a light on this, but talk to me a little bit about how it works procedurally. You conduct these investigations, you identify the fraud, then does the DOJ bring formal charges? Because it's my opinion, humbly, that you have to see people go to jail for these acts for other people to realize, oh, they're serious about this.
It's an all-of-government approach, just what President Trump has insisted and demanded. There's a new task force, as you know, that he discussed in the State of the Union. He launched it earlier this week with Vice President Vance in charge. He's brought a lot of great people to bear on this issue. Every one of us is contributing ideas. We, for example, can identify fraud financially. We can also identify it because we see aberrancies in who's getting a license. And folks that defrauded the government last year, guess what they're going to do? They're going to defraud it next year, too. So we give those tips to the DOJ, to FBI. I've spoken to Pam Bondi, Kash Patel, the Office of Inspector General. All of these folks are engaged. Until recently, there was a general nihilism about this problem because there was a sense that it's part of giving care to people who need support. You're going to have a little wastage. This is not a little breakage. This fraud is destroying these programs. If you truly love Medicaid, if you think Medicare is the crown jewel of our social safety net program, which I do, you need to protect the people in these programs. If you let fraudsters, and again, there's foreign countries we believe and foreign nationals certainly involved in this fraud, they will destroy what we as Americans firmly believe a good country should do, which is take care of our most vulnerable.
You know, just 30 seconds left, Doctor. If you run a lawnmower over a weed, it'll look good for a minute, but the weed will grow back up. Are you just mowing the lawn here, or are you going to be pulling out the weeds somehow?
Oh, we're ripping out the weeds. We're tilling the whole lawn. What we're trying to do is identify the bad apples and ban them from working anywhere in the healthcare services. And we're actually sharing our data with all the other stakeholders. Again, something you would think would have naturally been happening, but everyone was guarding their silo. We open sourced the Medicaid data so that everyone in the country could look at it. Medicare data widely available, so you can look at it's de-identified. You can't find out who got what service, but you know what was charged. That's how you find corruption at its very root.
Transparency is key. Dr. Oz, thank you so much for being here.
God bless.